In this lecture, we'll go over the venous drainage of blood from the brain, and this is the list of terms that you should be familiar with here on this first page. We have seen this image before when we were studying the brain, and I want to review this so that you can see the venous drainages. So this is a midline sagittally cut brain. So this is the anterior portion here, inferior, posterior, and this is a superior notch here at the top. And we're looking at the venous drainage. So remember that there is the cerebral falx, which is a fold of the dura that goes down from the top of the brain down to the corpus callosum. And it contains the venous drainage, a superior sagittal sinus at the most superior aspect that goes from anterior to posterior. And then you have the inferior sagittal sinus that runs just superior to the corpus callosum, and it also runs from anterior to posterior. It meets up with a vein of Galen here, just at the posterior inferior aspect of the corpus callosum, and then together the inferior sagittal sinus and the vein of Galen become the straight sinus and meet the superior sagittal sinus here at the confluence. And at the confluence then, the transverse sinus runs along the lateral aspect of the brain and more inferior aspect of the brain on either side. And we'll take a look at that in another view so that you're able to see that more clearly. So we've got the venous sinuses here. They drain the brain via the small veins first that empty into larger veins and sinuses. We went over the inferior sagittal sinus just superior to the corpus callosum, and then the superior sagittal sinus running along the most superior aspect of the brain. In this view from Netter's, this is a direct sagittally sliced, again, image where you can see behind the sagittal slice, so it's not just one slice thickness, but it's all the way through to the other side of the brain. We've got the superior sagittal sinus here going from anterior to posterior, and then the inferior sagittal sinus running right superior to the corpus callosum, meeting up with the vein of Galen, and then those two become the straight sinus. The superior sagittal sinus and the straight sinus meet at the confluence, and then from there, if you were to go laterally, so now we're going deep into the brain, laterally out to the right side of the patient, and you're going into the transverse sinus, which then becomes a sigmoid sinus, and then down into the jugular vein. So it goes through the foramen magnum and then down into the neck area, and that is how the blood feeds out of the brain and back toward the heart. This axial view shows the top of the skull being removed and most of the upper part of the brain. You've got the temporal lobe still here and the frontal lobe. So this is the anterior portion of the patient and the posterior portion. You can see that the straight sinus has been cut here, and so you've got just a little bit of it so that you can see that it does connect here to the confluence. So where the straight sinus comes in, it meets up with the confluence and then becomes a transverse sinus. So you've got the left transverse sinus here and the right transverse sinus here. On this side, they have cut the tentorium away so that you can see that more clearly. And as this transverse sinus goes laterally, it goes just posterior to the ear, makes a turn, and then turns more medially toward the foramen magnum before it becomes a sigmoid sinus and then goes down into the jugular vein. And that is where the blood flow exits the brain. So, and then in the front anterior portion of the brain, just around the pituitary, this is the sella and pituitary area, you've got the cavernous sinus on either side. The cavernous sinus, remember, houses the internal carotid arteries as they come up through into the brain before it becomes the middle cerebral and the anterior cerebral, before it bifurcates there. And also within the cavernous sinus are the nerves, the cranial nerves, 3, 4, 2 of the branches of the 5th cranial nerve as well as the 6th. And the cavernous sinus drains some of the blood to the sigmoid sinus here through the superior and the inferior petrosal sinuses. They're not in your study guide, they're not something you need to know, but just so that you can see what's happening on this image and how the blood gets to the sigmoid sinus and down into the jugular vein. So we have that same image that we saw in the previous slide here from Netter's. Slightly different view than the E anatomy, but still very similar. In this view, you've got the tentorium cut away on the left side of the patient, and it's intact over here on the right. You've got the straight sinus coming down to the confluence, and the transverse sinus becoming the sigmoid sinus, and then dropping down into the through the jugular foramen to become the jugular vein. Anteriorly here we have the pituitary gland and the optic nerve, as well as the internal carotid artery. So if you look at that from a coronal perspective here, and I've got it labeled here on the right, it's a little bit smaller, but this is a really nice view from E anatomy, and this is a similar one from Netter's. So you've got the optic chiasm here, and the infundibulum, the pituitary, the sella turcica, which is that bony saddle that the pituitary gland sits in. And this is a cavernous sinus, the right cavernous sinus, the left cavernous sinus sitting on either side of that pituitary gland. Remember, we've got the internal carotid artery coming up, and it makes that tortuous turn. So it comes up, and then it turns anteriorly, and then it comes up and comes back posteriorly. So that's why we're catching it in two places here. Internal carotid artery, and then we have the third, fourth, sixth, and 1 and 2 branches of the fifth. So we've got the trigeminal nerve, which is the fifth cranial nerve, and the first branch and the second branch of that trigeminal nerve. So this is the ophthalmic, and this is the maxillary branch. As well, we've got the anterior communicating arteries here. So this is a nice coronal view, whether you look at it labeled or unlabeled in E anatomy, and the same thing in Netter's. It's a nice place to review how that anatomy comes up through the brain and in the cavernous sinus itself. This area around the sella can also be an area where there may be pathology, and in that case it can affect multiple nerves. So there could be a problem with the optic chiasm. There could be a pituitary lesion or tumor, especially if the tumors get large. They can compress and put pressure on the nerves here. You may have sinus issues that may cause problems with the nerves. So any of those things can cause issues, and this is a really nice view for visualizing pathology in that area. On axial T2 weighted MRI scans, the sinuses are going to be dark. So you see the superior sagittal sinus posteriorly here, and anteriorly just a little bit of it here, and the falx separating the two. Remember, the falx is that fold of the dura that goes down to the area of the just superior to the corpus callosum. And then on this image here, you're catching the straight sinus just before it meets up with the superior sagittal sinus to form the confluence. So we're just a little bit superior to the slice where you would be coming into the confluence, maybe a slice or two above that. And here's a nice axial T2 weighted MRI image of the sinus confluence and the beginning of the transverse sinus. Axial image of the brain here with the anterior side of the patient and left. We've got the sinus confluence in the posterior part of the brain, and then that becomes the transverse sinus as it starts to exit the brain. So the transverse sinus will run laterally out toward the ear, just posterior to the ear, and posterior to the internal auditory canal as well on both sides, before it turned into the sigmoid sinus and then out through the jugular vein. On this image we can also see the basilar artery just anterior to the pons, as well as the internal carotid artery, and again that is within the cavernous sinus that is on the lateral side of the sella and the pituitary gland.